Okay, we're live streaming.
Good morning, everybody, and welcome. It is Wednesday, February 23rd, 2022, and this is the regular weekly meeting of the Lincoln County Board of Commissioners being conducted virtually over the Zoom platform and also being live streamed on YouTube. I am Board Chair Claire Hall, Vice Chair Katie Jacobson, and Commissioner Doug Hunt are also present, constituting a quorum of the board. First up is the adoption of our consent calendar. These are routine items we've discussed at previous meetings. Are there any items that either staff or commissioners wish to highlight or approve? If not, I'll entertain a motion for approval of the consent calendar.
I'll make a motion that we adopt the consent calendar as presented.
I'll second it.
Okay, we have a motion and a second for adoption of the consent calendar. Those in favor, please say aye.
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 Aye. It is approved. We move now to decision and action items regarding our short-term rental moratorium for new licenses. County Counsel Kristen Ewell will be presenting this issue.
Good morning, Commissioners. Kristen Ewell, County Counsel. So this is being brought forward today because our temporary moratorium is going to expire next week. And my recommendation is that you consider extending the moratorium while the issues get resolved with the courts. Currently, as you're aware, we have pending cases before LUBA and the Circuit Court. We have no resolution to any of those matters. And so until we have some kind of final resolution from the courts, the recommendation is that we extend this moratorium. And this would be extending resolution 21-3-12A. And the recommendation is to extend it for at least 6 months. You have any questions?
Any questions from the board?
I have none.
And I don't have any. Commissioner Jacobson?
None from me, just, and I think I know the answer to this is just for the benefit of the public. Counsel Ewell, so I think 6 months is appropriate, but for say, we did get resolution from courts or something, earlier, we always could repeal this and then have, the ballot measure or what have you take over. Is that correct? Like if we didn't need it the full 6 months?
6 months is, probably if you're going to look at appeals, possible appeals, which, we have no idea what's going to occur, but it's likely that appeals could occur, and 6 months is probably not sufficient time, but we can re-examine that as we approach that deadline.
Yeah, thank you.
Counsel Ewell, we seem to have consensus of the board to approve this. So can we make a motion for approval today and then approve the paperwork and the consent calendar next week?
That's correct.
Okay, let's do that. If someone would like to make a motion on a 6-month extension of our STR moratorium.
So moved.
I'll second it.
Okay, we have a motion from Commissioner Jacobson, second from Commissioner Hunt. All in favor, please say aye.
Aye.
Aye. And Commissioner Jacobson, didn't hear a vote from you?
Oh, I said aye. I think Doug and I just said it at the same time. Sorry, aye.
Oh, no problem. Okay, we've got a unanimous vote to do that. Nothing under discussion and information, so we move on to reports and our weekly report on COVID-19 and vaccinations. Florence Portal, our public health director, is going to walk us through that. Good morning, Florence.
Hey, good morning, commissioners. So we have some good news today, so that's good. I guess you can move on to the next slide, please. So, overall, we're trending back down from our steep Omicron surge. So last week we had seen a 41% decrease compared to the prior week, and this week we're seeing a 47% decrease in reported cases compared to last week. So that's really good. So that means that there is less work for our team. It's very interesting from one week to the next. It's either we are buried in cases or we're looking for work. So we're shifting staffing and adapting, once again to what the current need is. And so it's likely that we're going to shift some people towards our vaccination efforts rather than making calls to cases. Next slide, please. So this is pretty dramatic, and you can see the trend down at the state-wide level. We went to over 10,000 cases a day in the third week of January to less than 2,000 cases a day this week, which is really a good sign. Next slide. So for us in Lincoln County, the drop is pretty impressive, and we're still not yet at the end of February, and we have more cases as of today than we had at the peak of the Delta surge. So just to put things in perspective a little bit, it's looking good and it's still not great. What is good is that we're starting to see our incidence rates come down at 256 cases per 100,000, and then the test positivity is also finally coming down, where we were at about 25% positivity rate. We're now less than 10, which is a good sign too. Next slide, please. So this is kind of like the trend, our own AP curve, if you may, per week in Lincoln. So that's good. And the peak for us was the week of the 16th of January at 650 cases, and we're now at 144 cases this past week. So, and hopefully we'll come back down again. We have about 20 cases a day at this time reported to us. Next slide. So this is our year-to-year comparison. We're still out there in terms of cases reported. 2022 is the yellow bars. Next slide. Okay, so hospitalization. So similar trend down, and it's kind of fast, which is good. We are about 600 daily hospitalization in Oregon at this time. We are hoping to come down again, and remember the mask mandate is going to be lifted once we hit, I believe, 400 hospitalization a day. So it might be sooner than the 31st of March. You never know. Next slide. All right, so this is our local hospitalization data and trend for the month of February. So this is the slide for North Lincoln Hospital. And as you can see, they had seen, so what we are interested in, I know there's a lot going on in that slide. We are interested in the orange bar. So the orange bar is talking to us about the COVID patients in the hospital. So they've been pretty low. And then the green bar that we added last week is talking to us about, amongst those COVID patients, how many are in the ICU at North Lincoln. And the red or horizontal bar is kind of giving us a reference point in terms of overall capacity for the ICU at the hospital. So they're doing good. Next slide. Same for PCH. I mean, they've been a little bit more busy in terms of COVID compared to their colleagues in North Lincoln. Especially for the past 2 weeks, I mean, this past week they had about 4 COVID positive patients, and they've had 1 person on ventilated for a while in the ICU, but they're trending back down, and their capacity has been pretty good. They've received some extra staffing from the Oregon Health Authority and staffing agencies. Next slide. Okay, in terms of vaccination, I forgot to change the percentage of boosted people. I just checked and it was 43%. So we're climbing up slowly but surely. Our 5 to 11s are going up a little bit. I mean, we are just working at it, plugging along, still offering those clinics to our community members, and when they're eligible and or when they're ready for a primary series or boosters, will be there for people. Next slide. So this is a slide that I was interested in just to see, so if you look at the red bars are the total vaccine administered in Lincoln County by everybody, okay? Every vaccine provider. So obviously you can see that the trend is coming down this week. I believe the total vaccination provided in Lincoln County was 371. So that's low compared to where we've been. But what I think is good to see is that amongst those total vaccine administered, the majority of vaccines that we're administering are boosters, which is a good sign. And so the percentage of booster is about 60%. So out of all the vaccinations that are being administered in the county, about 60% of them are booster doses. Next slide. Okay, so those are our upcoming vaccination clinics. Obviously, Toledo was yesterday, so disregard this one. Newport Middle School is happening tomorrow. We have a clinic at the Oregon Coast Community College on Friday in Newport. Clinic at the Walport Community Center on Sunday. A clinic at Eddyville Charter School next week. La Jocuelita next Friday. And then Lincoln City Community Center on Saturday, March 5th. And Yahat's Pavilion on March 8th. And obviously we have all those clinics that we've been conducting that are recurring on a monthly basis. Next slide. All right, so this was discussed last week, but I thought I would keep it on. So indoor mask requirement is going to be lifted for Oregon no later than March 31st of this year. On March 31st, the school mask requirement is going to be lifted as well. There are no current plans to lift mask requirements in healthcare facilities for both patients and providers. It's important to realize that it's not because, I mean, if one wants to keep wearing their mask, and I'm going to be one of them in indoor settings, then it's absolutely fine. I guess the decision is up to the individual at this time or when the indoor mask requirement is lifted. So it is still, strongly recommended that people who are at a high risk of severe disease and hospitalization continue to wear masks indoor. And this is because after 2 years of this pandemic and kind of worldwide data available to us, we know that masks are a good protective measure and contribute to, slowing down the spread of disease. So if you are somebody who is not vaccinated, we recommend that you keep wearing a mask indoor. If you have a compromised immune system, if you live with underlying health conditions, if you're 65 and older, and if you live with other people who are at risk of severe disease, it's recommended that you keep your mask on when you're indoors in a public setting. Next slide. Right, so those are the same kind of steps that we know, but I like to kind of repeat them on the regular. So how do we reduce COVID transmission? Getting vaccinated and boosted is the best protective measure one can take. Wearing a mask in public settings indoors is another one. Limiting your social gathering and when you're gathering with other folks, maintaining physical distance is good. And those are good practices, even aside from, preventing COVID, preventing the flu, preventing the common cold, all of that. Washing your hands is a great one. To staying home when you're sick and getting tested if you can are all great ways to reduce COVID and other respiratory infection transmission. Next slide. Any questions?
Any questions from the board? Well, I'll say I don't have any, but it's nice to get really good news for the second week in a row.
I know, it's exciting.
Commissioner Hunt, your mic's on.
I was just going to say, yes, I think it's great work. Keep up the good work. Now that I have the opportunity, I'll ask kind of a forward-looking question. We had the Delta, we've had Omicron. What's kind of the word on the street as to what we might expect in the future?
Aside from the sisters of our latest variant, BA2, I believe, so it's Omicron sister, I haven't seen anything yet. It doesn't mean that something is not brewing somewhere, but I haven't heard anything at this time. What we're hearing and what I'm, I tend to follow European news as well, is that kind of a lot of countries are lifting kind of mask requirements and other measures. So we'll see how long, there is a theory out there that because Omicron was so transmissible, that it possibly built some type of community immunity, at least for the next 3 months. So when you think about the immunity we gain through vaccination and then the immunity that is possibly gained through people who got infected with the virus, and a lot of people got infected this time around. Some people offer this idea that we might see, less transmission for between 90 to 180 days. It's a kind of rough estimate.
Time will tell. So,
time will tell.
All right. Thank you.
You're welcome.
Thank you, Florence. We'll see you next week.
Okay, that sounds great. Have a good one.
You too. It is time for commissioner reports, and I'd like to start off with a couple of things. Good news on the electronic recycling front. This is an issue I know all three commissioners have been involved in during the last few weeks, that for a variety of reasons, the electronic recycling or e-cycling facilities operated by Dahl Disposal in Toledo and Waldport were facing possible closure as of March 1st. On Monday afternoon, I testified in a legislative committee along with Senator Anderson and Representative Gomberg for a bill that would provide a fix to this issue. And just really a couple of minutes before our meeting began, I received an email from Zach Dahl that a decision has been made to reinstate the majority of the e-waste collection sites, including both Dahl locations. So some very good news. And once again, I think an example of what happens when we all pull together on an important issue, we can make a difference. There's continued good news on the movement of the $1 million homeless pilot project for 8 communities, including Lincoln County. It passed out of a Ways and Means subcommittee and has been now, it goes to the full Ways and Means Committee. And I've been invited to participate in a news conference with Representative Gomberg about that bill tomorrow afternoon. Colleagues, do you have anything to share? Commissioner Jacobson.
Yeah, I will continue on the good news train here and say that last Friday I received an email from the state saying that from OCHS, saying that they had finally made a commitment and will be building 2 tiny home villages in Lincoln City for wildfire survivors. So it had been months of pushing them to make a decision and a commitment. I'm really happy that those resources will be coming. And my understanding is we should be able to move fairly fast and actually getting those properties developed for survivors and getting those tiny homes in sight. There's also a third potential tiny home village location also in Lincoln City that they, kind of needed some more information on, but we'll consider that one as well. But we have a firm commitment on 2 different projects. So really excited about that.
Excellent. Commissioner Hunt, do you have anything today? Looks like you're talking, but you're still muted.
I moved the screen.
Okay.
Yeah, a couple of things. First of all, I've sent out an email to the participants or representatives on the Area Commission on Transportation, Cascade West. We're having a meeting tomorrow night at 5 p.m. It will be virtual, but it's important for 2 reasons. Number one, we need a quorum, and number 2, we'll be reviewing the Connect Oregon applications and prioritizing those projects for the 3-county region, Lincoln, Benton, and Lynn. And so encourage those representatives of the cities, the ports, the tribe to attend. If you cannot, please send an alternate. I've sent an email out to those people with a link. But again, it's important so that we have a quorum and also so that we can advocate for the projects that we think are best for our region. Again, that's Connect Oregon funds, which are primarily bike and pedestrian, non-motor vehicle freight transportation, train, rail related. I guess I ought to introduce the cat that seems to demand attention. I occupy the room that was or has been the room of our youngest child. The cat has kind of taken over now that Courtney has moved out. She likes to hide under the couch when the grandchildren are pestering her, and apparently she likes camera time when I'm in the room during a Board of Commissioners meeting. So that is the kitty. And with that, I'm done.
Thank you very much. Can we call on Public Information Officer Casey Miller? Do we have anybody signed up for live public comments today?
Chair, I thought we did, but I think maybe we just had somebody participating and observing the meeting. So the answer is no. We do not appear to have any live input. I suppose if someone is there, they could use the raise hand function. I will, in the meantime, take you to the website. We did have one item this week of public input, and that was in regard to STR. subject. So it has also been archived on our short-term rental licensing page. And that looks like all we've got, Claire.
Thank you very much, Mr. Miller. And with that, I will announce that the office staff meeting for the Board of Commissioners office and County Council's office will be conducted virtually Monday morning, February 28th at 9. And the next public meeting, business meeting for the Board of Commissioners, Wednesday, March 2nd at 10 a.m., also conducted virtually. Until then, we'll see you next week.